It's 2 a.m. Your baby is crying. You fed them, changed them, burped them, and nothing is working. Panic sets in. But what if there was a simple pediatrician-proven technique that could soothe your baby in a matter of seconds? Today, we're looking at the hold, a gentle, natural position made famous by Dr. Robert Hamilton that calms crying infants almost instantly. Let's break down exactly how to do it safely. Step 1, the arm fold. First, gently fold your baby's arms across their chest. Secure them softly with your dominant hand. You aren't squeezing, just holding them snugly so they feel cozy and secure. Step 2, secure the chin. Support their chin gently with the soft side of your hand. Never put pressure on their throat or neck. Step 3, support the bottom. Next, use your other hand to comfortably grasp their bottom. Use the fleshy part of your hand, not your fingers, to ensure a firm, comfortable grip. Step 4, the 45-degree angle. Hold your baby at a 45-degree angle, leaning them slightly forward. This angle is crucial. It prevents their head from flopping back and helps soothe gas or mild reflux. Now that your baby is safely positioned, add subtle, gentle motion. Rock them smoothly up and down or gently wiggle their hips back and forth. Think soft, soothing rhythms, never sudden or jerky movements. Keep your hands relaxed so your baby senses your calm energy. Soft rhythms equals deep calming response. Why does this work so remarkably well? It recreates the cozy, compact environment of the womb. In those first few months, babies miss the snug pressure and constant gentle motion they had before birth. The hold triggers their natural calming reflex. Before you try this at home, keep these vital safety rules in mind. Age limit. This technique works best for newborns up to 2 to 3 months old. Beyond that, babies become too heavy and develop enough neck control that the hold is no longer comfortable or necessary. Finger pads, not fingertips. Always support your baby using the flat pads of your fingers or the palm of your hand. Never squeeze or dig in with fingertips. Check the angle. Never hold a newborn completely upright or flat on their back when doing this. The forward 45-degree slant is what keeps them feeling support. What if your baby keeps crying even during the hold? If your infant doesn't calm down after a minute or two, take a step back. The hold calms a fussing baby, but it won't fix fundamental needs. Ask yourself, are they genuinely hungry? Is their diaper wet or dirty? Are they experiencing severe gas or are they unwell? If a baby is sick or overtired, they may need a calm, dark room, a feed, or a call to your pediatrician. Parenthood is a journey of practice and patience. Give the hold a try the next time your little one is fussy. If you found this guide helpful, don't forget to like, subscribe, and hit the notification bell for more science-based baby care tips. Drop a comment below. Have you tried the hold yet? Thanks for watching.